Good morning. My name's Debbie Smart. I'm a research assistant at Newcastle University. I'm just going to let my colleague introduce.
Yeah. Hi there, I'm Sam Redgate, also from Newcastle University.
Sam and I are part of a team from Newcastle University, Northumbria University, a parent with experience of an educare service, and local authority partners who make up this evaluation. So as the title says, our presentation is a realist evaluation of an educare service in the North East. So just to give you a bit of background and context about why the service exists, there were shy of 81,000 children looked after by a local authority in England in 2021. And just by way of kind of acknowledgement, there's much debate around the term looked after. I appreciate that there's variation in referring to children and young people as being care experience when we're talking about them in the language that we use. But for the purpose of this presentation, it's the reference that the Department of Education make. So that figure was up 1% on the previous year, and there's been an ongoing rise in the number of children who are cared for by a local authority. We know that there are adverse effects on young people of not only the circumstances that led them to being in care of a local authority, but also the experience of being in care itself contributes to those events. And supporting families to remain together in a safe way can have a multitude of benefits for both them as individuals, the family and society. So the evaluation that we are undertaking is of an educare service called Keeping Families Connected. And the service aims to prevent children and young people coming into care and get over that initial crisis of an incident or an issue that causes that concern. Can also stabilise placements where children are currently in foster care and reduce the likelihood of them moving to a different foster placement. And it can also return and rehabilitate children with their families in situations where they may have had to go into care for a period.
Okay, so as Debbie sort of mentioned, our research is aimed really to evaluate the Keeping Families Connected service, and in doing so we're looking to expose the mechanisms through which the project interacts with families, and also the sort of the circumstances surrounding the service to produce outcomes enabled to inform future development of a sustainable intervention. And so in doing so, we had a number of objectives, and these are really to sort of, first of all, develop an understanding of how the intervention works and identify what factors impact on its delivery, to identify the mechanisms that facilitate and or hinder the service's effectiveness, and then also to assess the effectiveness of the service through routinely collected outcome information. And so as Debbie mentioned, we've taken a realist approach for this research, and really this sort of approach essentially looks to identify the ideas and assumptions underlying how, why, and in which circumstances interventions work. And so in taking this approach, we develop hypotheses, or programme theories as we call them, about how and why the service works. And also these programme theories are the unit of analysis we use within realist evaluation. And so a very brief overview, there's sort of 3 steps really within this. First of all, we develop programme theories, these hypotheses. We then test the programme theories using data, and then we refine and consolidate the programme theories, which looks very nice and linear up there. However, in practice, it's very much an iterative approach. As we're testing programme theories using the data we collected, we may then come back and develop additional programme theories. As we're refining them, we then go back and test them again. And so it's sort of very much an iterative approach to this. What we want to do today is talk to you a little bit sort of about the method, but really focus on the results coming out of our research. And so sort of in terms of the method, we split the research into 2 key phases. Phase 1 was very much concerned with developing our understanding about the area in which Keeping Families Connected works. And so in developing this understanding, we postulated programme theories about how educare services actually work and what outcomes can educare services achieve from existing literature. And so from this stage resulted in 4 programme theories, which I'm going to go through shortly. Phase 2 then focused on using these programme theories that we gleaned through the literature to structure our data collection in relation to understanding the processes, the context and the effects of keeping families connected as an educare service. And here we use sort of a mixed methods approach, including observations, practitioner meetings, review of assessment documentation, staff and family interviews, and also descriptive statistics to try and identify sort of what the outcomes were of the Keeping Family Connected service. Phase 2 is still in progress. However, to date we have 18 programme theories specific to keeping families connected. And these include the refinement of those original programme theories we had through the literature, and also theories pertaining to 3 key emerging themes from our data collection relating to relationships, time and trauma. As our research progresses, we're going to be further testing and refining these theories to provide a more nuanced account of how the service works. And just reflecting on some of the things we heard yesterday, I think it's key to say at this point, in coming up with the programme theories, testing and refining them, we've had a person with lived experience within our research team who's been really sort of instrumental in trying to sort of help us make sense of the data we gather. So due to time, we're going to sort of focus on the findings rather than go into too much more detail about the method. So sort of back to phase 1, the literature synthesis. The notion of structured parenting and family skills training was key within a lot of the literature. However, the training had to be relevant to and also acknowledge the importance of the influence and the skill base already within the family. And so therefore we postulated that in viewing a child's primary care as the catalyst for change, training that's able to be facilitated by an edge of care worker, but informed by formal service models, is able to support positive strength and skill development within the family. And this in turn empowers families and promotes pro-social behaviours. The actual context of where services are being delivered was really found to be quite key in the emerging literature. And so by delivering services within a family's natural home environment, observations by the worker were able to sort of ensure that the family felt understood, that they felt listened to, and therefore barriers to engagement were able to be reduced. This also came about by shifting the power dynamic, being based in the person's home from the worker to the family itself, and therefore it increased opportunities to promote positive family functioning. The notion of dedicated worker time also emerged as an important theme. Families accessing educare services are often experiencing multiple problems, and when people are experiencing these multiple problems, actually having a dedicated worker being able to work alongside them, being able to provide that intensive support, both in the form of practical but also therapeutic assistance in response to that family's need, was able to sort of build trust between the family and the worker, and again promote this idea of positive intervention effects. And lastly, when families are experiencing high stress, they need to have that immediate action-orientated response to assist families to contain and stabilise the crisis without breaking down. And again, this led to sort of positive engagement with services.
So phase 2 of our study built on our programme theories from phase 1 and involved speaking to people who have a range of experiences in contact with the service. So practitioners directly involved with the service, social workers who may refer into it, families themselves, which those interviews are currently ongoing, both with families who have achieved the outcomes that they'd hoped, and others where you know, children haven't been able to remain in their parents' care and things haven't worked out in the way that they'd hoped. We've also observed some meetings in which the plans for families are formulated between the Keeping Families Connected workers and social workers, and a range of documents that the service use to understand the needs of families, as well as the data they produce themselves on the demographics of both children and parents, how long interventions have lasted, a real host of things really. Okay. So as Sam mentioned earlier, we have 18 programme theories that we're currently working with. They're by no means perfect. They're in the process of being refined or maybe refuted in some circumstances, but we thought we'd focus on 3 that are particularly pertinent to keeping families connected and are under development. So the first of those is time. Keeping Families Connected works in a very time-intensive way. They promote that their service will work with families directly for 4 to 15 weeks, although there does appear to be some anomalies with that. And that intensive work may be daily, it may be 3-4 times weekly. It is full on. Oh, okay. Right, okay, no problem, thank you. But that's a really important thing in families, knowing what their goals are and the time in which they can achieve those goals. Okay. The second is relationships. The key thing in this being that the service works in a way where they really promote the parents' self-belief in their own capacity to make change and sustain that, which is maybe quite a different approach to other services, critiquing their parenting and pointing out the things that aren't working for them. Keeping Families Connected works in a much more positive way and gives the parents that belief and confidence through the relationship that they develop with them. The third is acknowledging the significance of trauma in families' lives, both for the parents and anything historical they may have experienced, and also the current experiences of the family at that particular time. This is something that we're continuing to unpick, because it's, you know, we need to understand how people work in a trauma-informed way, not just saying that. How does that transfer into the actual approach that they use when they're working directly with families to affect those changes? Okay, so our next steps, as I mentioned, we're kind of winding up our data collection with families. We'll continue to refine and refute and consolidate our programme theories and then share our findings. Thank you very much.